and saying that you are giving better health benefits to people with bogus asylum claims than Canadian seniors. So make the business case. Pitch me. It's Shark Tank. Let's do it. I'm a little uncomfortable issuing these permits. We have a 20% youth job crisis.
Imagine paying taxes all your life, struggling to get even basic health care as a Canadian senior, while someone with a failed asylum claim gets free vision care, mental health support, and even orthotics at your expense. Sounds unfair, right? But that's exactly what's happening in Canada today. In this explosive House of Commons debate, politicians are arguing over hundreds of millions of dollars in benefits for people who shouldn't even be here. How is this affecting Canadian seniors, our job market, and temporary foreign workers trying to earn a living? Stay tuned, because what happens next will shock you and reveal the real cost of Canada's immigration and health policies.
Thank you, Chair. So you're asking Parliament to give your department about $600 million, extra dollars, for the Interim Federal Health Program, and that is the program by which you give a lot of supplemental benefits like vision care and mental health supports to people even who have failed asylum claims. Do you think that it's fair that, like, let's say a Canadian senior who has paid taxes all their lives get less types of supplementary benefits than asylum seeker who has a failed claim, like somebody who's a bogus asylum claimant? Do you think, like, why should I give you $600 million for bogus asylum claimants when Canadian seniors can't get basic health care? How does that make any sense to you?
So thanks for that. Couple of things. One, if you took a look at the budget, we have introduced a copay to handle some of that.
How much do you expect people to pay?
But as well, the dollar amount that you referred to stems from the fact that it is an interim federal health program where the volumes were up from years ago.
Yes, because you #Welcome to Canada 300, I don't know, 500, 600,000 people who have bogus asylum claims. I'm aware that the numbers are up, and that's why you're asking us for. Right. I just asked you, is it fair? Like, you're asking taxpayers, us, to send you $600 million to pay for things like orthotics and vision care for people who have bogus asylum claimants and are still in the country. So is that fair? Why would I do that? That seems dumb to me.
What this debate is really about. These explains the core issue being discussed in the House of Commons, so viewers understand the context before forming an opinion. What you just watched is not just a political argument. It's a debate about fairness and priorities in Canada. The federal government is asking Parliament for over $600 million more for the Interim Federal Health Program. This program provides supplemental health benefits not only to refugees, but also to people whose asylum claims have already been rejected. That's where the controversy begins, because many Canadians feel the system is rewarding failure while citizens are struggling. Next, key points summarize what the funding request and program actually include. 1. Interim Federal Health Program provides extra health benefits. 2. Funding request exceeds $600 million. 3. Benefits can apply even after asylum claims are rejected. Why Canadians are frustrated. These focuses on the emotional and financial impact on Canadian taxpayers, especially seniors. The frustration you hear in this exchange reflects what many Canadians are already feeling. Seniors who paid taxes their entire lives are waiting months for care. Families are paying out of pocket for dental, vision, and mental health services. At the same time, taxpayers are being asked to fund benefits for people who were legally told they do not qualify to stay in Canada. For many, this feels deeply unfair. Next, these points highlight the fairness concerns raised by Canadians. 1. Canadian seniors struggle to access basic health care. 2. Taxpayers fund all federal benefit programs. 3. Rejected asylum claimants still receive support. Government justification. Volumes are up. These explains the government's defense for rising costs and why it is controversial. The minister argues that spending has increased because the number of claimants is much higher than in previous years. More people in the system means more demand and more cost. But for many Canadians watching, this raises another concern. If the system is overwhelmed, why expand benefits instead of tightening eligibility? Next, these points summarize the government's reasoning. 1. Higher number of asylum claimants. 2. Increased demand on health services. 3. Rising costs due to system pressure. How this impacts temporary foreign workers. These connects the debate to TFWS, who are indirectly affected by public anger and policy changes. Even though temporary foreign workers aren't directly mentioned here, debates like this affect them immediately. When the public loses trust in immigration systems, all non-citizens feel the backlash. Legal workers who followed the rules often face tougher policies, longer delays, and growing resentment, even when they did nothing wrong. Next, these points show how TFWS are affected indirectly. 1. Public frustration spills over to all immigration programs. 2. TFWS are often grouped with asylum claimants. 3. Policy tightening impacts legal workers. This debate doesn't stop here. In the next part, the discussion turns explosive, focusing on why failed asylum claimants still receive benefits, why deportations are delayed, and why the system doesn't simply cut benefits off. These questions go to the heart of whether Canada enforces its own laws.
So listen, I realize it's not something you would do, but I can tell you these money goes for people that are here because of human trafficking, goes for women that are here because of domestic violence.
Great, let's give it to those people. Why are you giving them to bogus people with failed asylum claims?
The duration of which these are temporary, so that they receive interim health
Right, so if somebody
measures.
has a failed asylum claim, they can still receive federal benefits. Why? That's dumb.
Again, we are introducing measures to ensure that we limit and curb those.
But
and
why
with
don't you
measures
just
that you
cut
are
it off?
obstructing, quite frankly.
Well, why? Yes, I'm accepting it. I think it's completely insane that you are giving better health benefits to people with bogus asylum claims than Canadian seniors. So I'm happy to obstruct that. Why wouldn't you obstruct that? Why wouldn't you say,
No,
this
you're
is banana
obstructing
crackers?
the fact that we're
Stop
trying
it.
to ensure that does not get done.
No, you actually are just asking. So if you look in the document you have in front of you, you've asked me to give you more than $500 million for health benefits for people who have no legal reason to be in the country that you can't deport. So make the business case. Pitch me. It's Shark Tank. Let's do it.
These are costs to cover interim health measures, emergency measures for
No,
people that are
no.
coming from war-torn countries.
But
that
it's also
need to
for
be-
bogus asylum
and
claimants.
it's also for treating people with diseases. I think,
No. I want to be clear here. We've tried to pass measures to restrict, like if somebody has a failed asylum claim, bogus, that they should be deported rather than get benefits.
And that's exactly.
Government says these benefits are for vulnerable people. These explains the government's justification for continuing health benefits and why this argument is being used. The minister argues that these health benefits are meant to protect people Canada considers vulnerable, victims of human trafficking, women escaping domestic violence, and individuals fleeing war zones. Most Canadians agree that real victims deserve help. But the controversy begins when these benefits are not strictly limited to those groups, creating confusion about who is actually receiving support and for how long. Next. Points summarize who the government says the benefits are meant for. 1. Victims of human trafficking. 2. Survivors of domestic violence. 3. People fleeing war-torn countries. Failed asylum claims, where Canadians draw the line. These highlights the main concern raised in the debate: rejected asylum claims still receiving benefits. Michelle Rempel-Garner repeatedly focuses on one issue: people with failed asylum claims continuing to receive federal benefits. From a Canadian perspective, this feels like a broken system. If a claim has been reviewed and rejected, many believe support should end. When benefits continue, it sends a message that rejection doesn't actually mean no, and that undermines confidence in the entire process. Next, these points outline the concern around failed claims. 1. Claims are reviewed and rejected. 2. Benefits continue after rejection. 3. No clear cutoff point. Why this is costly and unsustainable for Canada. These explains why taxpayers are worried about long-term impact. For taxpayers, this debate comes down to sustainability. Continued benefits, long appeals, and delayed removals all cost money. At a time when healthcare is strained and Canadians are struggling with affordability, many feel the government is avoiding hard decisions. The longer the system allows exceptions, the more pressure it puts on public trust and public finances. Next, these points show why Canadians see this as unsustainable. 1. Rising taxpayer costs. 2. Endless appeals and delays. 3. Strain on public services.
And that's exactly what we're doing. We're introducing measures to ensure that that speeds up, and that exactly
Yeah, but you're still
happens.
giving them benefits, so why would they leave? And you're allowing them to endlessly appeal. Why would you, this is crazy.
So the measures that we're putting in would
Okay.
curb all of that.
Yeah. Okay. Why are you still giving TFW work permits to fast food restaurants in major urban centers? That's crazy.
Again, as I
1 minute.
explained before, the ESDC goes through and decides where we have labor gaps. People who are getting these, businesses who are getting these have to go through an
But
LMIA assessment.
Did you tell Patty, I'm a little uncomfortable issuing these permits? We have a 20% youth job crisis. I am not going to give Tim Hortons in urban centers work permits. We should change the program. Have you said that to your colleague?
Any employer that receives these goes through a strenuous process where they have to show they cannot find, as well, it's 1% of our target.
But there's a lot of fraud in that,
it's-
and I have a hard time believing that a fast food restaurant in downtown Toronto needs a TFW for basic work. So have you made any effort to close the program off? Like if you said, hey, maybe we should bet on Canadian kids and scrap the program?
We're always betting on Canadian kids. That's
don't
why
think
we
you
have
are.
what we have. As in terms of facts, there's a 70% decrease
That
in
is
the
time.
temporary foreign
Thank you, Ms.
worker permits
Rempel-Garner.
in
Thank you.
low-wage industries.
Thank you, Minister Diab.
Temporary foreign workers and urban jobs. These explains the controversy around issuing TFW permits for low-wage jobs in major Canadian cities. The debate now shifts to temporary foreign workers and why work permits are still being issued to fast food restaurants and basic service jobs in major cities like Toronto. Michelle Rempel-Garner raises a concern many Canadians share. If unemployment among young Canadians is high, why are employers allowed to bring in foreign workers for entry-level jobs? This question strikes a nerve because it connects immigration policy directly to local job opportunities. Next, these points outline the concern around TFW permits. 1. TFW permits issued in major urban centers. 2. Jobs that many Canadians could fill. 3. Youth unemployment remains high. Temporary foreign workers and urban jobs. These explains the government's justification for continuing the TFW program. The minister responds by pointing to labor shortages and the labor market impact assessment process. Employers must prove they cannot find Canadians before hiring foreign workers. On paper, this system is meant to protect Canadian jobs. But critics argue that in practice, the process is often abused or poorly enforced, especially in low-wage sectors where wages and working conditions drive workers away. Next, these points summarize the government's position. 1. Labor shortages identified by ESDC. 2. Employers must pass an LMIA. 3. Program is described as limited in scale. Why this debate matters to Canadians and temporary foreign workers. These connects the policy debate to real-world consequences for workers and the economy. For Canadians, this debate raises fears about wage suppression and lost opportunities, especially for young workers trying to enter the job market. For temporary foreign workers, it creates uncertainty and stigma, as they are often blamed for problems they did not create. When trust in the system breaks down, everyone loses. Canadians feel pushed aside, and legal workers face backlash and stricter rules. Next, these points show the broader impact. 1. Canadians worry about jobs and wages. 2. TFWs face growing resentment. 3. Public trust in the system declines. This House of Commons debate exposes a growing tension at the heart of Canada's immigration and labour policies. From health benefits for failed asylum claimants, to delayed enforcement, to temporary foreign workers filling jobs in major cities, the question Canadians are asking is simple. Who is the system really working for? These decisions impact public trust, strain healthcare and social services, and directly affect job opportunities for Canadians, while also creating uncertainty and backlash for legal foreign workers who followed every rule. You care about Canada's future, fair immigration, and protecting both Canadian workers and those who come here legally. These debates matter. They shape policy, budgets, and everyday life. Stay informed, stay engaged, and don't let these conversations happen without you. Subscribe to the channel for clear, unbiased breakdowns of what's really happening in Canadian politics and immigration, because these decisions affect us all.